Today we're learning about the difference between a one-way and a two-way anomia. In general terms, an anomia is an inability to name things. Now, when a patient presents with speech or language problems, they or perhaps one of their loved ones might describe word-finding difficulties or perhaps a prominent tip of the tongue phenomenon in everyday conversation on history. But when we use the term anomia, we generally mean as detectable on a test of confrontational naming. That is, where a patient is presented or confronted with either real objects or drawings of objects and asked to name them. I have here an example taken from the naming section of the Addenbrooke's cognitive examination, which we'll return to in a little bit. In a nutshell, though, the difference between a one-way anomia and a two-way anomia is as follows. In a one-way anomia, there is impaired word retrieval when asked to name something, but there is intact word comprehension. That is, they still understand the name when they're told it. In contrast, in a two-way anomia, there is again impaired word retrieval when asked to name something, but there is also impaired word comprehension. That is, they no longer fully understand or perhaps understand at all the name when they hear it. And that's why this is one way because it's just impaired word retrieval, whereas this is two-way because it's impaired word retrieval and impaired word comprehension. In some further detail, a one-way anomia is sometimes also referred to as a retrieval anomia because it's only the retrieval of the name which is the problem. Very helpfully, in everyday clinical practice when assessing a patient, a one-way anomia is typically very responsive to a phonemic cue. So when they're shown something and having difficulty naming it, if they're told phonemically what the start of the name is, they generally get the name straight away. Crucially, and indeed by definition, they can identify the thing when they're told the name, and that's how you demonstrate preserved word comprehension. Ultimately, this is because in a one-way anomia, there is an unsevered lexicosemantic connection. That is, the connection between the word itself and the meaning of the word in the brain is intact. In contrast, a two-way anomia is sometimes also referred to as a semantic anomia. A two-way anomia is not responsive to a phonemic cue. And most importantly, a person with a two-way anomia for a name cannot identify the object or the drawing when told the name. And that's how you know there is impaired word comprehension. And this is because in a two-way anomia, there is a severed lexicosemantic connection. The connection between the word itself and the meaning of the word is no longer intact. So we return to the snapshot from the naming section of the Addenbrooke's cognitive examination, and let's consider two different performances. Someone with prominent one-way anomias might say, oh yeah, that's a watch, and that's and they're really struggling, but you as the examiner say, K, and then the patient immediately says, kangaroo. So it was very responsive to a phonemic cue. In contrast, if instead the task had been to point to what the examiner tells you to, and the examiner says, watch, they point to the watch, and then they say, kangaroo, and then the patient without any issue points to the kangaroo. All in all, overall, you've demonstrated a one-way anomia. In contrast, if another patient exhibited the following performance, what's this called? It's a watch. And what about this? Not sure. Is it a kang? Still not sure. And if instead they were given the task, point to the watch. This one here. Point to the kangaroo. I'm not really sure. Is it this thing here? Then that would be a two-way anomia for kangaroo. A little shout out, a plug for a term that is very informal, certainly not an official term, but that I and some of my colleagues use, of halfway anomia, to to refer to a situation where a patient has significant word-finding pauses evident on a test of confrontational naming, but they are ultimately able to name the thing without a phonemic cue. So, for example, they might go, it's a kangaroo. That's right, and they didn't need any cueing. Now here I have the full page of the naming section of the Addenbrooke's cognitive examination, and you'll notice why this is usefully arranged is that it contains things which refer to words of both high frequency and low frequency. And down the bottom there's a section of language comprehension. Sometimes we refer to this as a test of semantic linkage. For this one, ask the patient to point to the one associated with the monarchy. All four of the tasks ask the patient to point to something associated with some semantic property of the thing represented by the drawing above. This is the section which is assessing for that two-way anomia. Now, some other hints when you're doing a test of confrontational naming are the following. Semantic anomias, that is, two-way anomias, often are also accompanied by semantic paraphasic errors, where instead of saying the target word, when asked to name something, a patient says a semantically similar but phonetically distinct word. So, for example, instead of anchor, they might say ship, or instead of rhino, they might say hippopotamus, although I will caution you that that particular example, rhino and hippopotamus, seems to be quite common even in patients who don't have any significant language dysfunction. Something you may also see is superordination, which is where there is semantic simplification of the categories of when naming these things. So, for example, this might be named as simply an animal. And then this down here is also, that's an animal, just the same. It's just the same, this one, it's an animal. And you come through and, it's an animal again, just the same as this. So there's a loss of discrimination within a semantic category. You can only name the higher order category to which all of those exemplars belong. When two-way anomias are particularly severe, and if, for example, I detected a number of semantic paraphasic errors and semantic anomias on my test of naming, I would always then look to see if there was any extension to real objects. I would put in front of the patient an array of commonly available real objects like a phone or a pen and a watch, and ideally something with a slightly less commonly used name, to see whether or not, when shown the real object, that semantic anomia, that two-way anomia, persists. And if that was still the case, I would ask whether or not it extends to actual object knowledge. For example, instead of simply showing the patient a pen and asking what the pen is called, what this is called, I would ask the patient, what do you use this for? For example, if there's a profound semantic loss that goes along with the semantic anomia, they might not know that it's used for writing, or they might say something else, used for eating. There are some caveats to be aware of, though, when it comes to assessing anomias. The first is that if someone doesn't know what something is called because of their cultural background, you might mistake it for a true semantic anomia. For example, depending on where someone's grown up and their cultural background, they may have never seen a harp before. They may have no idea what this is called. They simply just don't have the semantic knowledge. That's therefore not a semantic anomia. They just never learned that name in the first place. The other caveat I would give is that if someone has a significant visual perceptual problem, such that when they look at any of these drawings, they really cannot appropriately perceive what they are to begin with, then they may also appear like they have a semantic anomia. They might look at this kangaroo, for example, and not know what it's called. And then when they're asked to point to a kangaroo, because they can't perceive any of these things properly because of their higher order visuoperceptual dysfunction, they might not be able to point to the kangaroo. So you might think that it's a semantic anomia, but actually they just have profound visuoperceptual disturbance. So that's just something to look out for. You need to have basically intact visual and visuoperceptual abilities in order to assess confrontational naming tasks accurately. Now, what is the diagnostic significance of all of this? Well, in simplified terms, a one-way anomia, or one-way anomias generally, they're a hallmark of logopenic variant primary progressive aphasia. However, I would stress that they're also quite common in more typical Alzheimer's disease with time, as there's progression to involve some of the perisylvian language networks. In contrast, two-way or semantic anomias, well, they're a hallmark of semantic variant primary progressive aphasia, due to pathology affecting the very anterior temporal pole. However, you may also see them in other FTLD pathologies, and also more advanced Alzheimer's disease when there's more extensive anterior temporal lobe destruction. So there you have it. That's the difference between a one-way anomia and a two-way anomia. In a one-way anomia, there's impaired name retrieval but preserved name comprehension. It's typically very responsive to a phonemic cue, and the patient will be able to identify an object that they earlier were not able to name when presented with options in a matching task. And it's typically a hallmark of logopenic variant primary progressive aphasia, but is also quite common in typical Alzheimer's disease with time. Meanwhile, a two-way anomia is impaired name retrieval and name comprehension. It doesn't respond to a phonemic cue, and also a patient won't be able to identify the object even when presented with options and told the name. Semantic or two-way anomias are hallmarks of semantic variant primary progressive aphasia, but you may also see them in other FTLD pathologies, as well as more advanced Alzheimer's disease. And just to finish off with, for fun, I'll mention that you can actually get category-specific anomias, so other kinds of anomias, although these are quite rare. One of these is proper noun anomia, where you have an inability to name specifically proper nouns, that is, names of people or places or brands. And that's most usually associated in the literature with a very particular insult or damage to the left or dominant anterior temporal lobe. You can also get an anomia restricted entirely to colours, that is, a colour anomia, where a person may still have intact colour perception, and you can demonstrate this by getting a patient to perform matching tasks, and they can match blue with blue correctly, etc. And intact semantic colour knowledge, for example, they can tell you what colour a banana is, but when confronted with different colours, they can't name them. That's very rare though. So that's where we'll leave it. The difference between a one-way and a two-way anomia is a crucial thing to understand when assessing language in cognitive disorders, and now you know the difference.